Good afternoon. We'll now start our pep talk. First of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Another reminder, please take the online Learning Kum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown in the slide. The link, I placed the link in the chat box. Another reminder, 50 OLETE certificates will entitle one mentee to a free voucher for a ROJoson telemedical consultation. We are now on our 101 pep talk. So those who have taken 100 OLETE certificates will be entitled to 2 vouchers already. Feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay, ready? Show your face. Show your face. 1, 2, 3. I have a patient empowerment program which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. Here are the topics in the core course. From October 23, 2021 onwards, I've been tackling health disorders courses and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Hospice Care in Cancer Patients. This is in consonance with the DOH, Department of Health, Health Awareness Calendar, okay, especially the June is, we commemorate the National Cancer Survivors Day. Okay, so the empowerment objective is for the lay people to have an essential understanding of hospice care in cancer patients. The contents of this pep talk will be the following: what is hospice care in general? In cancer patients in particular, what is the difference between hospice care and palliative care? What are the indications for hospice care in cancer patients? Can hospice care be done at home? What are basically done in hospice care for cancer patients? What is a typical hospice care for cancer patients at home? And what are my advocating statements and advice on hospice care? So let's start with what is a hospice care. Hospice care is a special type of medical and health care that focuses on the quality of life for people or patients who are experiencing an advanced life-limiting illness in which a decision has been made and no more heroic measures in curing the illness. So in the process of providing quality of life to the patients or the people with a terminally ill illness, hospice care can also provide quality of life to the loved ones or the caregivers of the patients. When you say no more heroic measures, this particular statement or phrase is embodied in the statements, let me die naturally according to the function of my body, no more anti-disease treatment or anti-cancer treatment with attempts for cure, just supportive treatment. So this is what is usually meant by when somebody decide or the doctors and the patient decide no more heroic measure, is that no more active anti-disease treatment, okay, just supportive management, especially in the pain management, in the realm of pain management, and then just telling everybody, let me die naturally. What is the difference between hospice care and palliative care? Hospice is comfort care without curative intent. The patient no longer has curative options or has chosen not to pursue treatment because of the side effects, because the side effects outweighs the benefit. Whereas palliative care is comfort care without curative intent, but the patient may still try curative options with the hope that they may be beneficial. Okay? So essentially, hospice care there is palliative care component, but there is no more heroic measures. So in palliative care, there could still be heroic measures. So example will be like this. The patient is declared to have a terminally incurable disease. Okay. You can choose palliative care or hospice care. You can choose initially palliative care, then hospice care, if he decides on no anti-disease treatment anymore. Okay. Now, what is hospice care in the cancer patients? We will now apply this to the cancer patients, essentially the same as hospice care for all types of patients with non-cancer. Example, end-stage renal disease, and Alzheimer's, and other diseases. Hospice care in cancer patients is a special type of medical and health care that focuses on quality of life for patients, for people who are experiencing an advanced life-limiting cancer, in which a decision has been made on no more heroic measures in curing the cancer. In the process of providing quality of life to the patients with cancer, hospice care also provides quality of life to the loved ones of the patients. So here, no more anti-cancer treatment with attempts for cure when you say no more heroic measures. So what is the difference between hospice care and palliative care in cancer patients? Again, essentially the same as those with terminally ill diseases other than cancer. Okay. So hospice care for cancer patients will be palliative care with no more heroic measures for the cancer disease. What are the indications for hospice care in cancer patients? We'll now focus on cancer patients. The indications are the following. The patient no longer has curative options. Either from the very start, there's really no cure for the disease, or after other curative options have been tried and have failed. So this is what is meant by no longer has curative options. So that's the starting point of the hospice. The patient has chosen not to pursue curative treatment because of the following reasons: low chance for cure, extremely low, side effects outweigh the benefits, financial constraints, unavailability of effective treatment in the community, and of course, other personal reasons that may be given by the patients. Hospice care is usually decided on cancer patients in the advanced stage 4, usually stage 4 with distant metastases, in which the chances for cure and prolongation of life are extremely low. And hospice care is usually decided on when a cancer patient is expected to live about 6 to 12 months or less if the cancer is allowed to run its usual course. So usually 6 to 12 months, now the patient usually decide on hospice care. When does one declare a cancer to be incurable? So these are the parameters that are usually being used. Track record that it is incurable. So there are diseases in which it's known that they are really incurable. Okay? And then if the cancer is in the advanced stage, especially stage 4, with distant metastases, and then there's from observation of the cancer during the course of treatment, there is a fast growth and it keep on recurring, or it recurred, and it is progressive. And then, of course, the last parameter to be used to declare that the cancer is incurable is that there must be an absence of effective curative treatment. So these are all the 4 parameters. Who decides on hospice care? Number 1, an empowered patient who knows about hospice care, who knows about the futility of cancer treatment already, and then who knows about the high probability of dying soon. So this is from an empowered patient. And then, of course, an advanced directive made by an empowered patient on hospice care is also one of the form of decision that has to be made by the patient. And the physicians and relatives can only collaborate, and they may advise, but only they can advise. They cannot dictate. So can hospice care be done at home? The answer is yes, because most of the time when you talk about hospice care up to the present, it usually, the implication is that it must be done in the hospital. But I like to say that it can be done at home. It can be done anywhere, at home, in the hospitals, hospice centers, and in nursing homes. With the popularity of telemedicine, telemedical consult, it will be more cost beneficial to have hospice care outside the hospitals because it's very expensive to stay in the hospital. So it's cost beneficial to have hospice care outside the hospitals, like homes, okay, nursing homes, kung merong hospice centers na mura, then you can stay there. I mean, hospice care can be given there. What are basically done in hospice care for cancer patients? Basically, these are the things that are usually done. Pain management is the foremost thing that is being done. Pain management in terms of physical pain, mental pain, and spiritual anxiety, etc. Okay. And then the main objective is to promote quality of life until the end of life moment. Again, as we said, in hospice care, there is a decision already on no anti-cancer treatment anymore. What is a typical hospice care for cancer patients at home? At home, let's talk about at home. Okay. So usually this one, it also includes pain management, physical, mental, spiritual, quality of life, promotion until the end of life moment. Okay. So when you talk about pain management, as much as possible, it will include the discomfort management. We usually target 0, but it's unrealistic. Usually there is still a minimal pain. Okay. At least the pain score has been brought down to a hopefully tolerable level. And then during the pain management also, medications can be given, which can be given through oral, through the mouth, through patches on the skin, and sometimes, if needed, intravenous or parenteral. Okay. Then, of course, oxygen administration. So the patient, the family must have oxygen prepared at home. Catheterization may have to be done by a caregiver, then tube feedings and other nursing care. Then, of course, in the hospice care at home, the relative must provide a room ambience for a good rest for the patient. Diet and fluids in hospice care, these are some of the things to consider because we hear a lot of times hindi mo kumakain, paano yan, dapat lagyan ng swero, no? Okay. So kaya usually they are forced to bring the patients to the hospital for the hospice care. But these are the things that we have to remember. Now we have to accept this as a reality. Okay. Otherwise, we will be sending patients to the hospital for hospice care. So decreasing food and fluid intake is a common natural part of the dying process. Most dying people do not experience thirst or hunger as death approaches. So don't worry about the thirst or hunger pag terminal ill na yung pasyente. Giving foods and fluids by artificial means like intravenous or IV, suero, does not usually prolong life or improve its quality of life. And we have to remember this number 3 because this is a very common misconception by patients, by lay people. So dapat may swero para humaba ang buhay. Ganon. Providing food and fluids by artificial means may in fact increase distressing symptoms such as shortness of breath, respiratory congestions, aspiration, restlessness, nausea, and vomiting. When people have difficulty swallowing, eating and drinking may put them at risk of choking. Artificial hydration does not provide nutrition. Yung mga swero-swero, kulang din yon, no? Kahit na paano. So if you really want a parenteral nutrition, you have to have yung mga, when you want to have some increased nutrition, you have to go for parenteral nutrition. Hindi lang yung ordinary swero. Swero, 5% glucose lang yan eh. Okay. So other things to consider, artificial hydration does not usually prevent or improve the thirst or relieve a dry mouth. So ang gagawin lang, frequent mouth care can relieve a dry mouth. So lagyan lang ng tubig yung bibig palagi. No? So as to mental management, I suppose these are the components. You have to make the patient accept the futility of cancer, curability, the acceptance of eventuality that they will die. Then there must be a last will on preparations for the material things. Then there must be an advanced directive, okay, on how they want to be taken care of in the last few moments, last few months. And then, of course, in the end, the patient must have a peace of mind. Okay. So I put there an asterisk here, death certificate, which I'm going to discuss later, because most of the time, relatives are concerned with the death certificate, especially if the patient died at home. Okay. So you can talk to the doctors, no? Doctors who are doing telemedical consultation, you can ask them to issue out a medical death certificate for you, just in case the time comes for it to be needed. Spiritual management, of course, probably it would be nice to have a belief in a creator, so you have something to look forward to, believe in an afterlife, and prayers and other religious rites, okay, of different religions. So that will help. So what are my advocating statements and advice on hospice care? All lay people must know the basic concepts, principles, and processes of hospice care. This is part of patient empowerment. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in medical management of oneself and also your relatives by knowing the basic concept and principles and processes of hospice care, which I just explained above. The 4Ks promote sound decision-making by both the patient relatives and physicians in the terms of, number one, formulating realistic goal of management, whether to go for curative care or to just go for palliative care or just go for the hospice care. So these are the three levels of decision that the relatives, the patients will have to make. Then promoting quality of life for both patients and relatives. It's not only for the patients, but kung natatanggap ng relatives ng pasyente, mas mag-i-improve din ang quality of life nila. Kung wala, there will be anxiety and depression all throughout. Of course, one of the benefit of this 4Ks will be you can control the so-called unnecessary expenses. Okay. One has to accept that some cancers are really incurable or already curable. Yeah, that's why there is a saying among the doctors, we cure sometimes, no? But we care always. Now we give compassionate care always. We provide comfort. But in terms of cure, it's not always curable. All diseases are never curable 100% all the time. In some cancers, one may just have to let nature take its course. If the cancer is deemed incurable already, choose the most practical and most cost-effective treatment to promote palliation. So start with palliation to relieve the pain. Okay. Then if the cancer is terminally incurable already, choose the most practical and most cost-effective treatment to promote a peaceful death. Ihandanan niyo yung peaceful death. Okay? So rather than a lot of these people are doing what a lot of people are doing in the country, okay? So they go all out, try heroic measures in cancer treatment, even if it is realistically futile. So we have to come to a reality that not all cancers can be cured. And there will be a point in which we have to call it quits. So another advice is to know the basis for declaring a cancer to be either curable or not curable. And if it's not curable, whether it's terminally curable already or not yet terminally curable. So we have to remember the parameters to use in declaring incurability of the cancer. Number one, again, the track record of the specific cancer. There are some cancers which are really incurable from the very start, or which have a difficulty in cured. But there are some cancers which can be cured also. Then the stage, if you go by stage 1, 2, 3, 4, the worst stage is stage 4, which is the far advanced, okay, with distant metastases. And then behavior of the cancer, just looking at the behavior by observation, by track record. So you look at the growth rate of the whether it's say if it grows to a big size within 1 year, now it's very fast. And then if it keeps on recurring, then that's another sign of in favor of incurability. Then of course the last one, there must be an effective curative treatment. If there is none, then we will mostly say that the cancer is not curable anymore. So these 4 parameters. For the terminally incurable cancer, I would advise that always have an advanced healthcare directive. This will help you, okay, help the patients as well as the relatives. And then in this advanced directive, just give the details on how the patient will be managed up to his last breath, okay? In terms of place, whether at home, hospital, and hospice, centers or nursing home, and then in terms of diet, nutrition, okay, instructions on whether the tubes will still be placed, suero will still be placed or not, and then also instructions on what are the limit of the diagnostic tests and treatment, etc. So let's nature takes its course for the terminally incurable cancer. So palliate to promote a peaceful death, palliate to promote a quality of life for both the patients and the relatives. Hattie Bryan's 4 steps to a peaceful death are as follows. We have to acknowledge the inevitability of death. We have to understand the limits of medicine. There's always a limit. We have to educate ourselves about the healthcare choices. Okay, what I mentioned in my lectures above. Okay, then communicate your wish and choose a proxy or the so-called advance directive. So summary and takeaway for this particular pep talk will be the following. I have presented the what is a hospice care in general in cancer patient. What is the difference between hospice care and palliative care? Indications for hospice care in cancer patients. Can hospice care be done at home? What are basically done in hospice care for cancer patients? What is a typical hospice care for cancer patients at home? And what are my advice on the hospice care? Takeaway in relation to patient empowerment, be always in touch with reliable medical information on hospice care in cancer patients. Knowledge is power. It gives power. Used to 4 Ks of patient empowerment, kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on hospice care in the management of cancer patients. So this ends my pep talk today. I hope I have empowered you to have an essential understanding of hospice care in cancer patients. But this hospice care is applicable to non-cancer patients also. So before we go to the question and answer portions segment, reminder, please take the OLETE 50 OLETE certificates will entitle one to a voucher for a free ROJoson medical consultation. Feedback, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we go for the interactions. Okay, ready? Do you want to include the picture taking? 1, 2, 3. Habol si Charita. 1, 2, 3. Okay, just save it. Okay. The floor is now open for questions, comments. Anything that you want to discuss here? Sharing of experience? Mayan, you want to share? Last time I'm sorry, I forgot you I didn't see your note last time. Mayan? Mayan Jose? Anybody wants to share? So alam na ninyo, yung hospice care is different from, may similarity with palliative care, pero yung sa hospice care, there's still a component of palliative care. Palliative care, basta walang curative intent, just to make the patients comfortable. But in palliative care, pwede pang gamutin with anti-cancer treatment. Okay. Whereas in hospice care, talagang give up na. Parang wala nang heroic measures. No? Hindi na gagamitin ng mga anti-cancer treatment. I have to emphasize the phrase anti-cancer. You can still do the medical treatment like pain management, no? Kung may hypertension, kung may convulsion, you can still give those medicines, but no more anti-cancer treatment like surgery, like chemotherapy, like radiation therapy. No? So anybody wants to share? Linda na isa. Would you like to share? Or Linda?
Hello po, Doc. Good
You want
afternoon po.
to share yung mga sisters mo?
Yes po, Doc. Sa mother ko po, i-share ko lang po sa inyo.
Uh,
Way back 2006. Opo.
okay.
Bali, Doc po siya ay naoperahan, natanggal po yung kanyang buong right breast, which
Okay.
is diagnosed po na sa kanya ay breast cancer stage 4.
Okay.
Nag-undergo po siya ng chemotherapy, then radiation po, Doc, until yun daw pong cancer niya ay pumunta na po sa bone, naging bone cancer na. So
Okay.
nung iniuwi po siya sa Lopez, Quezon, dito po sa amin,
Okay.
naka-wheelchair na po siya, Doc. Tapos
Okay.
po ay parang 2 weeks lang po namin siyang inilagaan sa bahay. Kasi po, Doc, ano na po siya yung mahina na siya. Kasi po ano po after radiation, mahinang-mahina po siya until, Doc, na coma na siya. Kumbaga po ang food po niya ay naka-NGT na, Doc, sa ilong na po
Yeah.
pinadadaan.
Tube.
Biniblender na po namin yung food. At tama po yung sabi ninyo, para hindi po sila nagugutom, binabasa-basa lang po namin yung lips, yung labi, water. Opo. So, ganun po yung na-experience ko na talagang need mo po talaga ng full attention. Talagang hindi ka makakapag-work 24 hours po. Talagang kailangan ibabantayan ng pasyente, which is nagawa naman po namin magkakapatid.
Okay. Thank you. Thank you for sharing. So yung mother mo went through, nung tinanggal yung breast niya, ano pa siya, no? Anong stage na siya noon?
Stage 4 na po, Doc, kasi po late na din po niyang Stage 4 na po, Doc, kasi late na po niyang napa-opera.
Okay. So, stage 4, bakit tinanggal pa yung breast niya kung stage 4 na?
At tanggal na po yung whole breast po niya, tinanggal po. Kumbaga po ay parang, kasi po, Doc, nung time pong yun ay, dito po ako sa Quezon, naiwan po ako. Mga kapatid ko po sa Manila ang nagdidesisyon kung ano po yung gagawin po na para po sa mother ko.
Okay. Okay, so most likely during that time, ang goal noon, kasi meron na siyang mga bone metastasis, di ba?
Yes po, Doc.
So inoperahan pa siya, it's really more for palliation, no? Baka,
Yes.
baka malaki yung suso niya, yung breast cancer niya, malaki, no? I suppose?
Yes po, Doc. Yes po.
Okay. So parang for palliation lang, tinanggal lang para hindi mabaho, hindi maano, no? Okay.
Yes po. Yes po, correct po kayo.
Okay. So after that, as I said kanina, once you have cancer in the advanced stage, you can still try palliative care, no? So tuloy-tuloy lang palliative care until such a time, that's a point that you decide na wala na, you want to go for treatment anymore. So yung sa kanya, bumalik siya sa Quezon, 2 weeks, then nag-coma. So I suppose tinanggap na ninyo, wala na. You don't,
Yes po.
hospice care ng tawag doon, no? Hospice care na. No?
Tapos,
Okay.
hospice care na po, Doc. Kasi sa bahay na po Opo.
Okay. Okay. So thank you for sharing, no?
Thank you po.
So anybody else who want to share? So one thing I'd like to emphasize is that a lot of people do not know what is hospice care. Kaya sige lang, sugod ng sugod, and then they cannot, and probably most doctors do not tell them the score. So tuloy-tuloy lang yung aggressive treatment, no? So to the point that they're spending a lot of efforts in trying to do something which might be futile, and then in the end, spending a lot. No? Okay. So you have to talk to your doctor, ano ba talaga ang prognosis ng pasyente? Na? Is it something that is still curable? That's the first question. If it's not curable, you tell them, you ask them. So last time we discussed about tanning. No, you can also ask them about the tanning. No, kung gaano katagal pa, give an estimate. No, and then if it's then make a decision whether you still want to try some palliative treatment in terms of palliative cancer treatment, no, or hospice na wala ng cancer treatment, no? Just for pain, for yung mga spiritual support, no? And then also the mental support, no? Ganon. So, tatanungin niyo sa doctor, no? Okay, para you can make a well-informed decision, no? Okay. So just always remember that there's a limit to what the doctors can do also. No? Any comments? Any more? Mayan, you still there? Mayan, Jose?
Doc?
Oh, Mayan, good.
Ano po?
Sorry, last time hindi ko nakita yung note mo. You want to share last time? You want to share now?
Kasi hindi na po,
Hindi
it's no
na
longer related to the topic.
not related na. Okay. Kahit nasa cancer. Okay.
Sa topic po ngayon.
Mhm.
Opo.
Okay. But have you encountered any patients na nasa hospice stage na, hospice care na?
Wala pa naman po.
Wala naman. Okay. So just
So
remember,
far.
kahit na hindi cancer. Di ba lately may namatayan ka ng isang relatives? Okay. Anybody else who wants to share? We still have 15 minutes. Must be scared.
Dok, naalala ko pala yung friend ko po sa US.
Oh, sige.
Sa New Jersey.
Okay.
Bali, yung mother po niya kasi, okay pa naman. Pero nagtataka po kami, but they decided to bring na lang sa hospice yung pinakamatanda sa kanila. Itong bunso po, yung barkada ko po, iyak ng iyak kasi parang euthanasia yung ginawa dahil sinasaksakan ng ewan ko ano in-inject doon. Tapos after how many weeks, months o 1 month yata, namatay din.
Anong sakit niya?
Cancer po.
Cancer din. Kasi as I told you,
Opo.
hospice care.
Pero po siya, nabuhay naman siya. Pa?
Sige, nabuhay siya ng?
Nabuhay naman po. Bali, cancer-free na po siya. Pero hindi ko po natatano kung bakit they decided na idalhin sa hospice. Siya naman po ang nag-aalaga doon sa mother niya. Yung eldest po nila ang ang nag-decide. Iyak po siya na iyak kasi nakikita niya sinasaksakan ng nung ayaw ko ano ini-inject po doon. Bas, ilang lang po namatay agad. Para hindi na daw mahirapan.
Yung pag sinabi mong hospice, this does not imply na euthanasia, ha? Hindi yung euthanasia.
Opo.
Okay.
Hindi po, yung po, yung pinagdalan po ng place.
Na?
Pinagdalan po ng place. Hospice po ang tawag nila dun sa US, sa New Jersey.
Pinadala ng plate?
Parang, pinadala po nila po doon, lahat po, 4 po kasi lang magkakapatid, nag-decide po yung pinaka-eldest.
Okay. So, okay. Number
Kasi
one,
kaysa
cancer.
mahirap pa.
Number one, it's a cancer patient, yung
Opo,
tinutukoy mo. But okay, let me
opo.
clarify, pwede ding ibang kasakit, no?
Ah,
Alzheimer, dementia, no? Yung end stage na Parkinson, no? Yung end stage, no? Yung talagang wala, hindi na no? Okay. So, pwede
opo.
din yun. Pwede din sa hospice, no? Now, in the US, there is a law yata, there's a bill, no? Kaya, saka meron mga services for hospice. May hospice centers, no? Okay? Outside the hospital. Hospice centers.
Opo.
And then, you can, the American citizens can avail of those hospice services, no? So, usually,
Ah,
baka libre yun eh. Di ba? Baka libre yun, no? Basta a
hindi ko
doctor
po natanong eh.
baka libre yon dun sa Amerika,
Ah,
no? Yung tinatawag na hospice rules, no? So basta there must be a doctor who must certify a patient in a terminally ill with a terminally ill disease na ang estimate duration of lifespan niya is less than 6 months, no?
ah,
So, yung doctor mag-estimate, no? Magdi-declare, no? Sasabihin niya, itong pasyente nito is about 6 months. Yung sinasabi kong tanning last week, di ba? So, may about only 6 months to live, no? So, she is entitled to go to avail of the services ng hospice, which I think is libre, no? Okay. So wala tayong ganun sa Pilipinas, na wala tayong mga legal services na libre, na okay. Sa Pilipinas, you just have to decide
hmm,
whether you want to have hospice or not, na okay. Magkaiba yun,
hmm.
okay? Nandiyan na. Sa Amerika,
Opo,
meron sila, they put it at 6 months. Kaya yung sa akin, I extend it for me. Yung kasi may mga they need resources, di ba? May mga hospice, may mga ano yan may magastos din yon, di ba? So may rules
opo.
na 6 months lang, 6 months to 1. Pag let's say napunta siya sa hospice, buhay pa siya after 6 months, ilalabas siya. Pwedeng
Ah,
ipalabas, na? Kasi you're availing these services eh. Di ba? Libre. Nakuha mo?
hmm. Opo.
And then, pag lumabas siya at na-reassess ng isang doktor ulit, okay, only about 6 months to 3 months to live na lang ngayon, pwede nilang ipasok ulit. No? Ganon. Okay.
Ah.
So, wala tayo
Diba,
niyan. Wala tayo niyan sa Pilipinas.
ano kaya Dok yung sinasaksak sa kanya, parang sabi ko parang euthanasia naman yun. Parang bumilis tuloy yung buhay niya kaysa yung nasa loob siya ng bahay nila eh.
Ang alam
Hindi ko
ko,
natanong eh.
most likely, sabi ko nga, when you say hospice, it's not the same as, it's not equivalent to doing euthanasia. No?
Opo.
Okay. Kumisan, baka pag euthanasia, ini-inject para madaling mamatay, di ba? Tama?
Opo.
Okay.
Ganun po yung sabi nung kabarkada ko, parang ganun po yung nangyari. Bumilis yung buhay niya nung pinasok sa hospice. Nung nasa bahay pa, malakas pa siya.
Baka nagkaroon ng komplikasyon lang doon sa mga gamot na in-inject, no? Okay.
Baka po. Ano na po
So,
siya, Dok? 87 na po siya nung time na yun.
yeah. Baka,
Old age na rin.
basta as far as I know, you cannot, even sa US, I don't know, may mga states na out of the 50 states, baka mayroong mga na parang legal na yung euthanasia in some states, di ba? Okay. Pero
Opo.
yung mga hospice, as far as I know, they don't include euthanasia. That's not part of it, no? Kung namatay siya because of injection, no, not because of pinatay siya. Parang Parang yung parang yung tawag doon, yung mga suppressor, di ba? Yung pinapatay with
Opo.
baka magkaroon lang siya ng komplikasyon na side effects sa injection. Ganun yun. No? Okay.
Opo.
So, as I said, wala
Thank you
tayong
po, Doc.
services like that in the Philippines. No? Okay. But the concept is the same. The concept is the same at it's parang maganda, it's realistic, it's practical, no? So we can apply that concept of hospice care, no? Okay. Kaya lang hindi libre, di ba? Hindi libre, no? So once a
Opo.
patient is terminally ill, no, na from cancer, from other diseases, no, pwede na niyong i-hospice. Declare that wag na yung heroic measures like you have to go to parang aggressive treatment pa. Just wala nang heroic measures, just supportive lang, no? Okay.
Opo.
So, pero hindi libre sa Pilipinas, no? Unless nasa government. So, government pwede mo ipasok, kaya lang siyempre hindi ayaw rin nila matagal, di ba? Sa government hospitals, no? I don't know whether baka meron isa o dalawa may alay ko may nursing homes tayo sa Pilipinas. Meron, no? Meron na isa, dalawa, no? Pwede ding, ewan ko lang kung tumatanggap sila ng mga may sakit, baka hindi rin, no? Ang tinatanggap nila yung talagang ano lang, yung matatanda lang, yung walang nagbabantay, no? Ganon, no? Okay. Pero may bayad yun, ha? Nursing homes natin sa Pilipinas, no? Okay.
Yung ano po, hindi ba yung tahanan na walang hagdan?
Oo nga, naririnig ko ngayon. So, buhay pa ba yun? Andiyan pa ba? Hindi pa naubusan sila ng ano?
Parang ano po parang kaibigan mother nung kaibigan ko nilagay nila doon. Hindi ko po alam noon pa po yun, 2 years ago. Hindi ko po alam kung meron pa pong gano'n ngayon.
Oo, kasi mahirap ding i-support yun no? Malaking gastos yun, no?
Opo.
Kaya sa atin, just remember that there's a concept of hospice care. You try your best to do it at home if you can, no? Para mas matipid, no? Kasi you cannot, pag nilagay mo sa hospital, matagal yon, di ba? Di ba? So hindi mo alam, buwan in terms of months. So pag months yon, magastos na yung hospitalization niya, plus yung mga gamot, lahat-lahat. Sa bahay na lang, di ba? So just just hire a caregiver, and then, but yung caregiver should be instructed also that this is hospice already, no? Huwag siya matakot, kasi kung minsan natatakot yung caregiver na to take care of those terminally ill patients, baka mamatay sa kamay niya, di ba? Ganon, no? So I have quite a number of patients whom I'm taking care through telemedical. They don't have to go to the hospital. I just have a consult with them through video, then advise them what to do. No? So they die at home without going to the hospital. No? Pero tanggap na lahat, tanggap ng mga relatives, tanggap din ng pasyente. That particular patient is going to die. No? So they just wait for the last moment, no? So ang kagandahan ng telemedical, I can provide advice kahit na without the patient having to go to the ER, having to see me in my clinic, no? Okay. So minsan nire-restahan ko pa ng yung mga gamot na yung mga painkiller na needs yellow pad prescription, no, like morphine, no, ganon, or mga patches, no, ngayon. So, bibilin lang nila yon, and then, i-apply lang doon sa bahay, no. So, ano pa? Yun nga, sabi ko
parang
yung...
alala ko yung gamot, parang morphine yata yung sinasaksak doon sa mother niya.
Ayun, morphine. Tama, hindi naman, no, morphine, pwede naman morphine eh. It's not a, Unless baka nagkaroon siya ng side effects from the morphine. Pero usually you can give the morphines para mawala yung pain, no? Okay. So ang pinaka-popular painkiller sa mga terminally ill patients na masakit na nasasaktan, we usually give morphine, no? Yan ang pinakamura eh, no? Okay. Okay. Okay.
Thank you po, Doc.
So the other thing that probably all of you will have to know is that try to remove the fear of ay kung saan ayaw ng mga tao, your relatives dying at home, no? Tama? So pwede naman, no? I don't think there will be any problem there, no? Dying at home, no? In terms of death certificate nga, somebody can issue the death certificate for you, no? Walang problema. Kasi kung minsan yung iba gusto nila ipa-declare sa ER, no? Para death na siya, namatay na siya, papadeclare lang sa emergency room ng hospital, no? Para makakuha lang yung death certificate, no? So, madali naman kuha ng death certificate as long as you have a doctor attending like me, no? May telemedical, no? So this year probably I have 3 patients who die already. Then sasabihin ko lang sa kanila, okay, I'll give you give me the form, I'll sign the death certificate, or I will dictate it and then ask somebody, a doctor near their place to sign it. No? Ganun. Okay. Okay. Any comments? Any thoughts? Nana? If there are no more questions, it's 3 o'clock. Nana? Bet walang tanong sa chat box? No
There's
question.
nothing at that box. No question.
Okay. Okay, if there are no more questions, we'll call it a day. Anong topic next week? Dengue. We'll talk about dengue fever. Okay. Kasi it's dengue month, June na eh, di ba? Dengue, National Dengue Awareness Month, no? So we'll talk about dengue next week, no? Okay? So we'll call it a day. We'll see each other next week. Bye-bye.
Thank you po, Doc.
Thank you, Doc. Bye-bye. Happy weekend.
Thank you po. Thank you po, Doc. Happy Father's Day po, Dr.
Happy
Hoson.
Father's
Father's
Day!
Day, Doc. Ray.
Thank you. Thank you.
Father's Day, Doctor.
Happy Father's Day po, Doc.
Thank you. Thank you. Bye-bye.
Bye-bye po.
Bye-bye.